Good morning, my name is Adrian Dix. I'm BC's Minister of Health. Last night, I was made aware of serious allegations of racist and abhorrent practices in an emergency room or emergency rooms in British Columbia. If confirmed, the conduct is beyond unacceptable. The allegation is that a game was being played to guess the blood alcohol level of patients in the ER, in particular Indigenous people, and perhaps others. If true, it is intolerable, unacceptable, and racist. And its effect on patient care is intolerable, unacceptable, and racist. I have appointed Ellen Turpel-Lafond, an outstanding British Columbian, to investigate the facts of this issue and make recommendations about immediate and long-term next steps. Ms. Turpel-Lafond, as you know, is the former child representative in BC, an outstanding lawyer, and former provincial court judge in Saskatchewan. She will follow the facts wherever they lead, and that is my expectation. As you know, I will also be reaching out to Indigenous leaders in British Columbia, especially in healthcare, the First Nations Health Council, the First Nations Health Authority, the First Nations representative on the boards of health authorities, and many more, as we address the fundamental issues that are involved. For a number of years, we've been working together collaboratively, all the partners in healthcare, to pursue cultural safety in our healthcare system, cultural safety and humility in our healthcare system and in the practices of that system. That work is more important than ever. It is fundamental to what we need to do together. And we must continue those efforts, expand those efforts, and work on those efforts. But with respect to these practices and these actions, action is required. It's why, having learned about it last night, we've appointed Ellen Turpel-Lafond. It's why we need to continue to take action on these matters today to determine both the remedies required and the reconciliation required to go forward.
I just don't know what health authorities this involves, how long it's been happening, and how widespread it's been.
Well, that's why we need, as I say, these issues were brought to my attention last night. All of those facts have not been determined, but there is sufficient information to require this investigation. And that's why I've asked Ellen Turpel-Lafond to work on to go through to establish the facts, and also for us to immediately engage in a process of engaging in remedies and reconciliation on these questions. Because should these practices be confirmed, they are unacceptable and racist.
I mean, there have been reports of systemic racism in Canadian health care for years, and I'm wondering if you regard this as a one-off situation, if this in fact happened, or whether you recognize a larger issue that needs to be addressed here.
There is absolutely a larger issue that needs to be addressed. That's why we're engaged together in a path that to pursue in practices in healthcare, cultural safety and humility. Absolutely there is. And I have, since becoming Minister of Health, regularly met with Indigenous communities, with communities around BC, and issues like this have been raised. I think these issues are, the particular issues are so significantly serious that they require an investigation by someone of Ms. Turpel-Lafond's stature and authority, and I think that's important. And we have to continue to do this work because it is beyond dispute that people have suffered in our province from systemic racism in many fields, and healthcare is one of those. This requires, in my view, an immediate response. I found out about it last night. I was in touch with, obviously, with senior officials of the Ministry of Health. I contacted, and others, I contacted Ellen Turpel-Lafond and asked her to lead the investigation and of this issue. I think she has both the credibility and she has the credibility to do that, and will do an excellent job. And as well, we need to engage with the First Nations Health Council, with First Nations leadership on this question as well. I consider these allegations very serious. Of course, we have to assess the facts, and that requires an investigation to take place, but we also have to see action.